Hi, welcome to this week's Chairside Chat. I'm Dr. Alex Touchstone. I'm going to be your guest lecturer for this Chairside Chat and for the next several. And this week I decided to select something that I find to be a bit of a problem and thus deserves a solution, and that is dealing with the occlusion as well as the thickness of restorations, especially whenever working with multiple restorations. So let's take a look at a case example. So as you can see, I've got two preps, and I've already begun the design process for the crown on tooth number 31. We're allowing the software to handle the autogenesis, and the proposal's pretty good, but we need to reduce that mesial aspect of this restoration just a bit. So I'm going to go over into the incremental change tools box and just bring that back in a bit. And we'll rotate the model around and make sure that we're happy with that. And once we've done that, we might also grab the rubber tooth tool and pull that mesial area in just a little bit more. Again, rotating around, making sure that we're happy with the changes. And it looks something like that. All right, that looks good. Of course, we haven't even considered occlusion yet. We've got to build our other restoration first, and then take a look at it from there. But you can see we've got our interproximal area. It's important to get that set before designing the second restoration, because we want the second restoration to design against the desired proximal surface area of the first one. So now we'll reposition the green tooth so that we're roughly where we want to be. Hit apply and allow autogenesis to do most of the work. And you know what's real nice about this software is that the occlusal morphology is going to come out looking real good. Of course, I've already pre-positioned the insertion axes for both of these before I started the webinar, and that certainly has a lot to do with whether or not we get a good proposal. So now we've got that, we can drop down over into some of our tools and consider what we're going to do next. And we might begin to think about occlusion. Now, I'm going to turn on the bite registration view in translucent mode, but I'm going to bring the translucency all the way down, as you saw there. Next, I'm going to turn on the color coding for the occlusal contact strengths, and we can see that as I toggle back and forth between restorations, I can see the contact strength for each one individually without having the bite registration obstructing my view in any way. Next, I might take the rubber tooth tool and begin to refine these areas where there's a bit of hyperocclusion. That's one way to handle the occlusion. I'm going to show you another way in just a moment, but that's certainly one way to get started. We can also take a look at our thickness, and we can see that we may be a bit thin there on the mesial. And so we've got to deal with that, especially if we're going to use, say, Empress or Lava Ultimate. So let's get a closer look at that. Let's scale up a bit, and we'll turn on our slice tool. Now what I want to do here is bring the slice plane over to the center of that thin area, and then I'm going to rotate up and scale up so I can see the outline of the opposing tooth along with the restoration in cross-section. We can see we've got some space there, so let's use our rubber tooth tool again to pull that restoration up closer to the opposing cusp. And of course we've done that. Now we might have to, or we should think about whether or not we have changed the occlusal scheme in any way. So let's turn off the thickness tool, turn back on our occlusal contact strength tool, and then as I pull the slice tool over a bit, we can see that, yes indeed, along the mesial marginal ridge area, we're now in hyperocclusion. So let's grab that rubber tooth tool again and bring the strength of that tool down just a bit so we can make a more discrete change to that contact area without adversely affecting the thickness of the restoration. So we can pull that down to fit against the opposing cusp. And again, this is one way to control occlusion. We'll take a look at another method in just a moment. Once we've done that, we can then view our result by rotating around. And we can turn that slice view on and off, turn the thickness tool back on. Get that slice tool out of the way. Now we can see that we've got adequate thickness everywhere, and our occlusion is looking good. So let's go over to tooth number 30. And we'll do some similar things. Only this time we're going to use a different tool. We're going to use a much simpler tool, modify the contact strength with a simple button. And you can see that down on the lower left I've got my contact strength set to -80, and I just click the redefine button or refine button, and we can do the same thing for the interproximal contact and refine both those contacts with the click of one or two buttons. Now notice I do have one area that's very close to my margin that appears to be in hyperocclusion. Now there's a limit to what we can and should do here. We need adequate thickness of the material right around the margin, so I might refine that just a bit with my smooth surface tool, knowing that perhaps I may need to go back clinically and adjust that area in the mouth. Next thing we can do is turn back on our slice tool, bring that back over a bit, and just double check that area that I'm concerned about. Grab our rubber tooth tool again and refine that just slightly. I'm going to move the slice tool over a bit to refine the center of that contact area. And again, there's a limit to what I want to do here. I want to leave adequate thickness for proper milling. And I understand that the next step will be to adjust that clinically if necessary. All right, now that we've got that taken care of, let's take a look at the thickness of the restoration on the axial wall area. And we can see that we're a bit thin. So there are a couple of ways we might address this. One might be to modify the entire surface by using the expand tool. However, when this is done, it also moves the cusp positions themselves. And I don't want to do that. I may adversely affect my occlusion. So I'm going to reach down deeper into the tool set, and I'm going to pick up my rubber tooth tool. And again, I'm going to pull that axial wall area out just a bit and get it where I want it. Now you may notice that it appears that my restoration is a bit thin around the marginal area. I do use chamfer margins, and I try to be conservative with my preps whenever possible. I have found, however, that if I use a properly maintained milling unit and fresh burrs, I do not have problems with the milling quality, and in fact I find that my restorations fit very nicely. So I'm going to leave that alone, and I'm going to simply smooth off those marginal areas just a bit with the smooth tool. And that's the way I'm going to do it. I'm going to leave it just like that. Next thing I'm going to do is take a quick look at the occlusal surface. I've got a triangular ridge there that needs to be smoothed just a bit. Now let's double check everything. Let's look at our occlusion. That looks good. Let's look at our thickness. Okay, we're good there. And we're almost ready to mill. So let's move forward and think about that proximal surface there just a bit, that proximal contact area. And I'd like to refine that just a bit. So I'm going to broaden it mesially for the molar with a few simple clicks. And then I'm going to take a look at that contact area by removing the adjacent tooth, turning back on my contact strength tool, and that doesn't look too bad. Might want to broaden it just a little bit more. It's up to you. But otherwise, we are ready to mill.